Welcome back to the Chinese Medicine Podcast. I'm Marie Hopkinson, herbalist, acupuncturist. In today's video, we're going to talk about why are there so many different ways to treat pain with acupuncture. Why might you go to one practitioner, they do this, another acupuncturist does it this way. There's so many different ways. And why would you even come to a video like this? So I'm assuming that you're a patient that's had acupuncture before and you're interested in maybe understanding a little bit more about why does my practitioner do it this way and not that way. Maybe you've got extreme pain and you want to use acupuncture and you're looking to understand like what would be the best method to go about having my pain treated. And more importantly, how can you understand what your practitioner does? I'm actually going to uncover that. It's a bit of a mystery because you sometimes just assume all of them are the same, all acupuncturists are the same. Well, they're not. There's thousands, literally thousands of styles of Chinese medicine in the world. And yeah, okay, some of those are pretty fringe and maybe not that common, but there's probably about 20 to 30 really common styles of acupuncture being practiced in the Western world. So America, UK, USA, that's America, Canada, Australia, these kind of countries, New Zealand, and so forth, right? So this will be really interesting to you. Also, you might be a student of Chinese medicine that's learning acupuncture and you're wondering why they're different styles, or you've got a patient with pain and you're thinking maybe what different ways could I go about treating the pain. So this video is primarily for the first people, the patients, and you're interested in learning about it. But I know that many students come to my channel and you're totally welcome to come and partake of the goodies. So let's get into it. What does acupuncture do for pain? How does it work to treat pain is probably the first thing to think about. So the most common thing you would assume is you're going to stick needles in where the pain is. And we call that local points, local needling. So what that means is, let's assume I've got pain in my shoulder. The practitioner is going to ask you where is the pain, and the needles could go in the shoulder where the pain is or very close to that. So for instance, like your gallbladder channel goes across the top here, your large intestine channel comes right up to like your acromion process, and that comes into the joint of your shoulder. So you've got the large intestine channel and the sanjiao channel kind of here. You've also got, sometimes people have shoulder issues at the pectoralis, major, minor areas, and that could be the lung or the pericardium channel even. And also you have people that say, my shoulder's sore, but it's actually their back, their small intestine channel behind or in the shoulder blade, the rhomboids, that kind of stuff. So there's a lot of channels, a lot of ways that we can think about using those channels even, but there's a lot of channels around the shoulder. So this is the same video for whether your pain's in the back, in the buttocks, in the lower back, in the neck, in the head, anywhere the pain is, but we'll just use the shoulder for an example. So that's local points, doing the acupuncture where the pain is. Now, what mostly probably surprises patients is when you do points that are not in those areas, and a common thing is to actually combine the two together. So you'd have what they call local points and distal points. Now, there's different ways of choosing those distal points. Probably the most common or most obvious way is on the same channel, using a point that's on that area, but it's distal. It means it's farther away from it. So let's use the shoulder again. I'm not using this because it's close to you be able to see me. So let's say we've got pain here in the joint, like you might have bursitis or something like that, or even frozen shoulder, these kind of issues. So if we were to sort of want to activate this area, we might use a point large intestine 4 on the hand, which that channel goes down the arm. Now, excuse if I'm not getting exactly right because I'm trying to do it by watching myself in the video. But so if we go here, large intestine channel down the hand to this point. So this would be Hergu, large intestine 4, would be a common distal point for pain in the shoulder because it's on that same channel. Now, it can get even more tricky where you have different methods. And that's what we're going to get into in this video. There's numerous what they call distal acupuncture methods, okay? And some practitioners have their own unique style. Some use a combination of these different methods within that. So one of the most popular methods now in acupuncture is called the Dr. Tan balance method. Some people just call it the balance method. Now, this was popularized by, obviously, a doctor called Dr. Tan. He's passed away now. And this idea is kind of using, for every channel that's sick, there's like balancing channels that balance that out. And there's also this idea of mirroring in your body. Now, I do have a little video that kind of explains more about that exact method for something like sciatica. And if you understand how this works, you can use this technique for acupressure, right? So the purpose of this video isn't to really teach you this technique. You can actually go onto one of my other videos to kind of learn more about that. And also I'm going to be teaching that kind of idea as part of the new course that I'm running this year. So I've just decided literally at the last 2 days or 3 days ago to open the enrollments for another batch of the course that I've done in the past. This is going to be new and improved, and it's a whole 12-month kind of course, and it'll teach you all the self-help tools that I know of, and I know of a lot, that you can actually utilize for yourself. You'll start by learning the yin yang and the 5 elements and the basic understandings of how we see our body in the world, call that foundational concepts of Chinese medicine. And then there's a 12-week course on Chinese dietetics, diet therapy. So you'll learn about foods as medicine, but also how to make things like medicinal wines, herbal teas, congees, all this kind of stuff. And then in the last part of the course, it's the self-treatment things, like exactly what we're talking about now, this balance method, how to understand the channels, where are they, and how to use them, okay? So if you're interested in that, you can click the link below to find out more about the course, because it'll be a really exciting way of deep diving into Chinese medicine. So if you like the stuff on this sort of channel and you want to learn it more formally, but you don't want to pay $100,000 for a course, and there's nothing really in between. It's like either you do these sort of things ad hoc by YouTube, or you might be lucky enough to have a course offered to you. Like once I've run a course at a local TAFE, which is in Australia is like a technical college. It's like people can go there just to learn, and it was a 12-week or 13-week course about Chinese medicine, and every week people just came to kind of learn. Well, there's kind of those things are few and far between. So this is kind of a bit more in depth than even just a 12-week course, because it's 3 lots of 12 weeks. And it's kind of the limit of what you could learn to treat your own self, right? But there's going to be a lot in the course. Anyway, so we'll get on with what I'm meant to be talking about in this video. Now, getting back to the idea of distal treatment or balancing the channel. So let's assume, again, this large intestine channel is the perpetrator of the problem, the sick channel. Dr. Tan would call that the sick channel. Well, there's basically other channels that are used to balance that channel. So there'll be points on the legs, and there'll be points on the other hand. And technically with that method, we don't actually needle the local area at all, like if you're doing that method specifically. In my practice, I kind of use a bit of many methods together sometimes, and it depends on what the patient needs, and it depends on what else we've tried, and what's worked and what hasn't worked. So what I'm getting at is there's lots of tools that we have in our toolkit that we can use. Like if that doesn't work for pain, there's another method we can kind of try to use for pain. But for the most part, this is a very useful method for treating pain, especially when it's first happened. Like not for pain that's been there for months and months, years and years, although it can be used for that. But its moment to shine, its best time to be used is acute pain. So things that have only just happened within a few days, even up to a few weeks. That's when the distal method only is a great method to kind of use. Now, what's really good about this method is because we're not going to needle this local area, what a practitioner will often get you to do is like move in a way that replicates the pain. So they'd say, oh, Marie, if you've got that shoulder pain, like what do you have to do? And I might say, oh, when I do this, oh, I get this pain just sort of, oh yeah, I can feel it when I do that. So what we would do is we would palpate, which means to press the other channels that balance that, let's say the large intestine channel. And what we would do is we would feel along there until the person feels a sensation of soreness. Like we were basically trying to find the most sore point which corresponds to this area. Now, this is also based on this method, that this idea that your shoulder joint relates to your hip joint, but this area also can relate to different parts on your hand. So it's like there's like a mirror of your body. So one of the ways of the balance method is thinking about like your waist can be your elbow or your wrist. Now this might be getting a bit more complicated than what you expected to get on this video, but I want to let you know that there are these potentially complicated methods that your acupuncturist can use, and you know they've studied all this stuff, so I'm not trying to teach you how to use this method in this momentary video. This would take, you know, a few hours, let alone weekend, you know, months and months of kind of learning and practicing for practitioners to really get familiar with it and get it right. And so basically they're going to break down all this complexity into making it something simple that they can do on you in the treatment. So that may be why a practitioner is kind of asking you, which point do you feel the most sore? They're pressing, and then you're like, oh yeah, that's really sore. And it will be away from the area that's the sore area. It'll be on your leg. It'll be on your ankle. It'll be like, you know, a weird point on your finger, and you'll be like, oh, I didn't know that was going to be so sore. So what they would do is they would needle those distal points and then get you to do that movement again, and then go, oh, Marie, oh yeah, I can feel that. Yeah, it's hurting when I do that. And then they manipulate the points, which means they're going to tweak them. They're going to touch them. They're going to do something to them so that you feel those other points, and then you do that movement and you're like, oh, hang on a minute, oh yeah, I can actually move that. And what's great with that distal method is because there's no needles in that area, the patient can often move that around. Now these are very generalized scenarios, so you know you may have pain in a certain area that you can't move around and replicate the pain. I've had patients like that, and we won't know until you get off the acupuncture table to be able to move around and see, oh, is the pain better? Is it worse? Has something changed? So this is one of the methods that's used for pain. And in that case, there'll be lots of the acupuncturist pressing you to find the most sore point that seems like it's nothing to do with this thing. And you're thinking, why are you pressing? Why are you doing my ankle? Why are you focusing on my knee? I came in here for my shoulder, Marie. Like, what's going on? So most practitioners are going to explain to you what they're doing and why they're doing that. And what's great with that TAN method is often in the treatment, the patient will feel better straight away or at some point in the treatment. It might not go completely away, but the pain will get less. Like I would ask you, does it feel, what's the level of pain? You might say, oh yeah, before the treatment, let's say when I'm doing this, and I'm like, oh yeah, the pain's like, 8 out of 10. And then the treatment, and then we do it again, and they're like, oh, it still hurts, but it's like maybe a 4 out of 10, And often with this distal balancing method, frequent treatments are needed. So every couple of days, I know some practitioners who do it every day. In China, it's very common to do the treatments every day for a course of treatment, which often will be 10 days. That may sound like an exorbitant amount of treatments. In China, obviously, the cost to the patient is less than what's charged in Western countries. But there is this utility of frequent treatments when it's first happened, right? So at least 3 times a week, if something's just recently happened and you're not using any herbs, you're just using acupuncture on it, you kind of need to hit it quite regularly. And then often that will resolve the condition, and we can't say for sure because everything's variable. But in my experience, if you treat things early on like that, you're less likely to have then a lingering injury that's like, oh, every time I do this exercise, now my old shoulder injury sort of flares up. Now this thing happens. So there is the potential benefit of sorting something out early on and treating it until it's properly resolved, so that you don't have those lingering bit of, in Chinese medicine we call that blood stagnation, a bit of blood stagnation left over there. So that's one method, right? The first one we've got is the local treatment. The point's all in the area where it's sore. The second one is the distal method. Now, within that distal method, one of those is the TAN method. One of those is distal points on that same channel. So technically with the TAN balance method, if it was the large intestine channel that's sore, we wouldn't needle large intestine 4 on that same side. We're not going to needle that channel. We're going to use other channels to balance that large intestine channel. So there is just distal points on that same channel. That's sort of like 2A, 2B. Within that distal method, there are other methods. Within one method, there's even more methods that think about things in terms of micro mapping on your body, or they call it microsystems. So I'm not sure if you realize that there is a thing called ear acupuncture. There's literally like a map of your body on your ear. There's a Korean hand acupuncture, which is like a map of your body on your hands. There's another style of acupuncture called Tung, T-U-N-G, Tung style acupuncture, different to Tan style. I know there's a lot of styles. I already said there's like thousands of styles. So the distal acupuncture can be especially with the Tung style. I'll use a pen here, just the back of a pen, but kind of like looking for very, very small areas. So there might be many points just even in this area here of my knuckle, of my finger, looking for those points. And it's actually a different system of acupuncture to the channels of acupuncture, the 12 regular channels that you're taught in TCM school if you're a student of Chinese medicine. Getting back to the purpose of this video, right? It's to actually tell you that there's a lot of different ways that acupuncturists can treat pain. So maybe you've stumbled upon this because you're worried that your practitioner isn't doing it right. Like, I've had acupuncture for many years and they did this, and now I went to a new one and they did that. What's happening there? Are they doing it right? Maybe you're seeking treatment for pain and something you've been using hasn't been working. Well, there are other styles, and maybe your acupuncturist doesn't know that style, and it might be time for you to seek out a second opinion in Chinese medicine. So if you're committed to Chinese medicine, you love it, you might be new to an area and you're looking for an acupuncturist and you want to know, like, how will I know what kind of styles they do, and how will I know if that's going to, be suitable to me? So we've got these various distal methods. Now, another method that we have for treating pain is kind of like treating the pain from a functional or a cause perspective. So there are points in our body that treat the organs and not so much the channels. Or the idea is they're still going to activate the channels because they're on channels, so they have to do that. Let's say you've got deficiency and you want to tonify the body. Well, there's points that can do tonification. There's points that can move blood stasis, just in a general sense. So one of the most common ways that this type of pain relief would be used is, like, for instance, gynecological pain. You could say, that pain is on a channel, but it's not so much it's not a musculoskeletal issue. The cause of the pain could often be blood stasis. There's points like, for instance, spleen 8, DG, which is on the inner side of the leg, the lower leg. And that point is a classification of points, part of a classification of points called a She-Cleft points, which are known to treat acute conditions and treat pain. And it's also on the spleen channel. The spleen has to do with making blood. The spleen channel goes into that area around the body. You've also got the liver channel encircling the genital sort of area. So we kind of maybe I sometimes have patients who have pain in a particular area, and they're worried, if they have genital pain, they're like, are you going to stick those needles down there? That's not really what they want. There's ways that we can treat pain by not having to treat that area. Now, we could go back to that distal method I said before. That tan balance method could be one way, distal points along that channel, but also thinking, well, what's the cause of this person's pain? Like, do we just need to simply move blood, or tonify qi, tonify yang, something like that? There can be pain caused from those reasons. So that hopefully this video has been a bit useful and helpful to you to kind of understand that there are different methods that acupuncturists use to treat pain. And it is one of the top things that we are known to do. There's plenty of research-based evidence, like Western medicine-based evidence, on the utility of acupuncture for pain. It's one of the things that it's well known and well documented, not just in historical evidence, but also in modern research. And I'll put some of those references below this video. So if you're interested in looking up some of those studies that have been done on stopping pain with acupuncture, then you can kind of go and do that. So I hope you've enjoyed this video. If you're new to the channel and you haven't subscribed yet, make sure you hit that subscribe button. We're trying to reach 10,000 subscribers this year and hopefully 100K at some point in my lifetime. That would be awesome. And if you'd like to support the channel, jump onto the link below to check out my courses. I'm starting my new 1-year program in June 2025. So that's really exciting, and I'd love you to join us on the course. And you can find out more about that at the link below. So hope you have a pain-free time, whatever you're doing, and wish you all the best in your pursuit of happiness and pain-free life.